Hi, everyone, and welcome back to Chapter 2. The second topic in Chapter 2 is psychological methods of treatment. So let's find out in a brief way. This is just a brief introduction to the ways that the different theoretical orientations use treatment techniques from their perspective to help people get well. So, first of all, here are the items to focus on for the second quiz. Symptoms of major psychological disorders, theoretical views, neural transmission, Freudian theory, and psychology professionals. I feel like this one is a little bit too vague, so I might try to narrow that down a little bit more for you. So I would pause here and write those things down, and as you read the text, look for the answers to these areas. Okay, so before we start with actually doing treatment, I think we should talk about who does treatment. So as you can see in this table, we have occupation, degree, common licenses, prescription privilege, yes or no, and average income. So these are ranked, I think, from top to bottom for how much responsibility the individual can carry. So the higher your degree, the more money and the more responsibility you have. So, a psychiatrist is the one that's going to see the most seriously affected individuals who have a mental illness, and they are going to be working with people who have been put themselves in life or death situations. A psychiatrist becomes a medical doctor and then specializes in psychiatry by doing a psychiatric residency. Psychiatrists can choose whether they want to do counseling or not. Most psychiatrists, but not all of them, do very little counseling and usually prescribe medications. We have a shortage of psychiatrists, so we really need their expertise in prescribing medications for our clients. Psychiatrists would call their clients patients because they are medical doctors and would see someone initially for a bit longer, half an hour to an hour. I know one wonderful psychiatrist in Modesto, Dr. Danielle Bradshaw. She sees people for an hour and a half to do a good assessment, but most of them will see someone for half an hour or less in their initial assessment, and then people would return for 15-minute medication checks. So if the person also needs counseling, they're going to be needing to see the psychiatrist plus one of these other counseling psychology professionals. So psychiatrists can prescribe medication, and you'll see on the rest of these, it varies a little bit for clinical psychologists. There are about 5 states in the United States that have granted prescription privileges to psychologists because we just don't have enough psychiatrists. So the clinical psychologists in those states get extensive extra training so they can be prescribing professionals. Also, some psychiatric nurses can prescribe medications, and this is extremely helpful. Most psychiatric nurses work in the office with a psychiatrist, so he or she would not be on their own prescribing medications. They would have someone available to them for consultation, but in many cases they have prescribing privileges, just like our nurse practitioners. I put here an average income, $250,000. It all depends on how the psychiatrist sets up their practice. To see Dr. Bradshaw initially is $390 for that hour and a half. So you can imagine if she had a full schedule of people paying her that much, she would make well over $250,000. Many psychiatrists consult in prisons and hospitals and with the courts. They can make a lot of money doing that. So this is really just an average person doing psychiatry 5 days a week would probably make about $250,000. A clinical psychologist gets a doctorate in psychology. It's actually Doctor of Philosophy in Psychology. That's what PhD stands for. So all PhDs are doctors of philosophy, and then you say in English or in math. So it's no different for a clinical psychologist. So he or she can get this kind of PhD, which is a more research emphasis degree, or they can get a PsyD, Doctor of Psychology. And the PsyD is a newer designation where when a person knows they want to be a clinician, they want to work as a consulting psychological professional, then they might want to focus on becoming a PsyD. And there are various University of California locations. One that comes to mind is Irvine, gives the PsyD degree. So these two degrees can do just about the same thing. Many universities require, if you want to teach there, you would need the PhD rather than the PsyD. But other than that, in clinical practice, these would be equal. So they need to get a license as a psychologist. And in California, our Board of Behavioral Science, or the BBS, is the one that gives out the licenses related to psychology, unless it's a nursing designation. So they become a psychologist. They, like I said, don't have prescription privileges in California yet, but I think it's right around the corner because we just don't have enough psychiatrists. If you think about becoming an MD and doing an internship as a psychiatrist and making $250,000, that's unacceptable. So most people that have the ability to become a doctor and do a specialty would rather do some kind of specialty that makes them more than this. A beginning orthopedist that works at, for example, Sutter in Modesto is guaranteed $450,000 in their first years. So it's hard to say you want to become a psychiatrist. We have a program in California now where they are willing to pay for medical school for people to become psychiatrists. So that's kind of an interesting idea. Okay, a clinical psychologist now, average income 150,000. It all depends on how much you choose to charge and how many hours you want to work. These guys charge anywhere from $150 to $250 an hour. So you can do the math on that. If they were getting $200 an hour, 40 hours a week, they're making a lot more than this 150. School psychologists, many of you are familiar with them. They get a doctorate in education and a license as a licensed educational psychologist, no prescription privileges, and around $78,000 a year. A counselor psychotherapist with a doctorate might become a psychologist or an MFT. Again, they would have the PhD or the PsyD. They would not prescribe medications. Hey, come back here. I did not tell you to go away. Okay, so at the master's level, which I know many of you are interested in, you would earn a Master of Arts, a Master of Science. I don't even know what that, Master's in Counseling. Most people that become counselors at the master's level have a Master of Science, and they take the Marriage and Family Therapist license. Again, that's from the BBS, the Board of Behavioral Sciences. And any of you interested in any kind of licensing in psychology can go to the BBS website and look at all the requirements for all the different licenses. They don't prescribe medications, and they can make 80 to 100,000 on average. Again, if you are good at what you do and you develop a lot of people who are referring to you, you can work as many hours as you want to work, and you can charge within reason whatever you want to charge. So an MFT with a long waiting list can raise their prices and make more than this for sure. And this is the license that I have. Okay, so clinical social worker, now that's going over into the sociology realm, but they are treating professionals. So they get these degrees, master's in social work, doctorate in social work. They become a licensed clinical social worker. They don't prescribe medications, and they make 60 to 80,000 or 100,000. So clinical social workers get a BA in either psychology or sociology, but for their masters, they go into a LCSW program, a Master's of Social Work leading to the license in clinical social work. People are always asking me the difference between this degree and this degree. I say if you're trying to figure out which one is better for you, go get 2 catalogs from colleges that offer these degrees and look at the classes they offer for a master's in psychology and the classes they offer for a master's in sociology, and see which classes you prefer to take, and that would tell you which one of these you would want to be. They can both be in private practice, they can both bill insurance, they can make about the same amount of money. So it really would depend on what you are interested in. Now, more typically, licensed clinical social worker does the kind of work that a social worker might do, but they also do counseling. So if that appeals to you, you might want to do this. If you really want only to do psychological counseling, then maybe this one appeals to you more. Thank goodness for the psychiatric nurses. They are helping fill the gap that we have in our limited number of psychiatrists, and they get a Bachelor's of Science in Nursing, a Master's of Science in Nursing, and some of them earn a doctorate in nursing. Like I said, it varies as to whether they can prescribe, and they make around 80,000. These numbers are really rough estimates. I just want you guys not to rely on that. I just have updated this recently with my estimations. You'll hear me later talking about behavior therapy, and you can become a board certified behavior analyst with a BA in psychology, and you wouldn't prescribe medications, but you could earn something in this range more if you get the master's and be a board certified behavior analyst. It would probably be a little less than this if you do it at the BA level, but some of these guys really specialize in this and get even doctorates in behavior analysis. And you can be a consultant to a variety of programs. You could run your own program, and mostly you'd be working with developmentally delayed children and adults, and children and adults on the autism spectrum. So that gives you an idea of the careers, and I want to let you know that on, let me see, I'm doing this on, yeah, there it is, on March 3rd in Forum 101 from 4 to 6. I will be talking about careers in psychology. So if any of these things appeal to you and more, please come at that time. I'll offer you extra credit for that event. So that again is March 3rd from 4 to 6 in Forum 101. Okay, well, for continuity, I think I'll stop here with just this explanation of careers and move on to therapy in our next section. Bye.